Good morning, everyone. We're just going to wait a couple of more minutes for people to join, and then we'll get started with the webinar. Good morning, everyone. A warm welcome to all of you for joining this session this morning. My name is Karen Mitchell-Moore, and I'm the Executive Head of Healthcare Consulting at NMG Benefits. Today, we are joined by Vishen Pillay, a wellness specialist who's been in the industry for many, many years and is here to tell us a little bit about the details around how we can support first of all, spot and support others as well as ourselves around mental health conditions, particularly in this particular presentation, depression and anxiety. Without further ado, I'm going to hand you over to Vishen. But before I do that, if you do have any questions, please use the chat line and we will answer them as we go along. Thank you so much, Vishen, and a warm welcome to you as well.
Good morning, Corin, and thank you for having me. And good morning to everybody online. I hope you're geared up for a really exciting and informative session today. So I want to start off by acknowledging something really important, and that is mental health challenges like depression and anxiety are far more common than many of us want to acknowledge or let alone realize. In South Africa alone, studies show that nearly 1 in 4 adults will experience a mental health disorder in their lifetime, which is a scary number. But that also could mean that one of your colleagues, a friend, or even a loved one, even you may face these challenges at some point. Now, when we talk about depression and anxiety, they aren't just feeling sad or stressed, but they are mental health illnesses that can affect your energy, your focus, your sleep, motivation, and even your physical health. And yet, many people suffer in silence. Sometimes this is out of fear, sometimes because of the stigma attached to it, or simply not knowing where to turn for help. Today, we're going to talk openly about these conditions. We're going to explore what they are, what are the early warning signs to watch out for in ourselves and others, and we'll explore evidence-based treatment options that are available specifically in South Africa, both from a therapeutic and pharmacological perspective. The goal of this session is not just awareness, it's about empowerment, because mental health is like any other aspect of our health. And the earlier we recognize the challenges and take action, the better outcomes we'll have. So as we go through the talk, I encourage you to listen, to reflect, and think about the ways that you can support yourself and those around you. And like Corin mentioned, if you do have any questions as we're going through, please do type them in the Q&A chat box and we will address them at the end. With that being said, let's have a look at what we'll be covering today. We're going to start off by talking about what is the mental health continuum? Is your mental health impacting you physically? We'll then deep dive into depression and anxiety, and then we'll talk about the types of rest that you can get to minimize these symptoms. How do you set healthy boundaries, which is especially useful for anxiety, and then signpost you in terms of how to get help going forward. Now, when we talk about overall mental health, we are talking about the individual's emotional, psychological, and social well-being. It encompasses how an individual thinks, feels, and behaves, as well as how they manage stress, relate to others, and make choices on a day-to-day basis. So good mental health generally means functioning well, managing life stresses, and maintaining fulfilling relationships as well, while maintaining a positive outlook on life. It refers to the overall balance and well-being of an individual. Now, when we discuss mental health, I often have people say to me, I don't know how to describe my mental health at the moment. I suppose I'm okay. And by saying I'm okay doesn't give me a clear indication of where a person is. So on the screen, you've got the mental health continuum, which gives you 5 categories to now classify where you are on the mental health spectrum, whether you are in crisis, whether you're surviving, or whether you're excelling, or anywhere in between as well. Now, when we start to acknowledge where we are on this continuum, we can start to put purposeful symptoms with each of those categories as well, which gives us a little bit more of an indication of what we are feeling. It also gives others an indication of what challenges you may be experiencing, how you may be dealing with some of the stresses that your day presents as well. And that gives us the tools to be able to navigate you as an individual, or if you were engaging with me as an individual, and what my limits and parameters are in terms of the interaction that we're having. Now, as much as mental health exists on a continuum, very much like our physical health, it's important that we know at any given point in time where we are, the same way we can describe our physical health. Now, when we talk about mental health, we understand that everybody has mental health, and it's everybody's responsibility to be aware of what their current mental health state is. And then we talk about mental health disorders, or mental health illnesses, or mental health conditions. I know that's a lot, but I'll break it down for you. When we talk about mental health disorders, we're talking about mental illnesses or conditions that are affecting a person's thinking, their feeling, their behavior, and their overall functioning. And these can range anywhere from common issues like anxiety to something more severe like depression, bipolar disorder, schizophrenia as well. Now, mental health disorders require a professional diagnosis and treatment, and they manifest through symptoms and dysfunction. It's also important to understand that these mental illnesses can exist alongside mental health on a well-being spectrum, and we'll look at that shortly. Before we go into that detail, I want to clarify in terms of the difference between mental illness and mental health conditions. So we've understood now that mental illness refers to a diagnosable condition, and it requires medical diagnosis and treatment. Mental health condition, on the other hand, doesn't necessarily require a diagnosis. It's generally a state of being. So, for example, if I'm stressed, I don't need somebody to tell me I'm stressed. I can visibly recognize the signs and symptoms. I can acknowledge that I am experiencing high levels of stress. Very different to experiencing an anxiety disorder or a major depressive disorder, which would need to be diagnosed based on the symptoms and the dysfunction that I'm experiencing. So you'll hear throughout the session that I'll refer to mental illness and mental health conditions. And I just want you to have this thesaurus of information in terms of what that actually means. Now, when we talk about the well-being spectrum, we understand that you can have good mental health and have mental illness, and that can coexist. You can also be in a state where you don't have a mental illness, but you have bad mental health as well. So we need to understand that they are not mutually exclusive, they exist alongside each other. What this means in practicality is that somebody, for example, who's been diagnosed with a major depressive disorder, can be getting treatment for their major depressive disorder, which is a mental illness. Okay, mental health illness. And because of that, they are in a good mental health state. Somebody else, on the other hand, could be experiencing panic attacks. They could be highly stressed out, which means that they don't have a mental illness. Remember, mental illness is a diagnosable condition. So this is not necessarily diagnosed. Panic attacks and stress are not diagnosed. We just recognize them within ourselves. And this could also be alongside bad mental health. So we need to break the stigma around the idea that bad mental health is directly linked to mental illness, because it isn't. you can still thrive with mental illnesses as well. So I hope that's settling in. So when we talk about mental health, many people say, no, mental health exists in the mind. It doesn't have a physical impact on the body. And this is not necessarily true. What happens in the mind often manifests in the body as well. So when we look at mental health, there are physical symptoms that we would look out for as well. These could start off if you're experiencing high levels of anxiety with fidgeting. You may have a racing heart or higher heart rates. You may be chewing on your lips, grinding your teeth. You may have bags under your eyes. You may be experiencing headaches. And then you could also be experiencing brain fog. This is a symptom of anxiety. It's also an early symptom of depression as well. You may be experiencing high levels of fatigue, which could eventually turn into depression. Tension in the shoulders, clenching your jaws, high blood pressure, biting fingernails. These are all things that we would look out for as physical symptoms of poor mental health or early signs of mental health illnesses. Now, in South Africa, we unfortunately have a lot of stigma attached to mental health illnesses, mental health conditions, and it's because a lot of cultures have made us believe that certain attributes make a person unacceptably different from others, which leads to prejudice and discrimination against them. So it's important for us to understand that mental health doesn't discriminate. Mental illness doesn't discriminate either. And once we start to accept that idea, we start to realize that it is actually a lot more common and closer to your door than you would like to believe. So I want us to at least start exploring the idea that you or a loved one or your colleagues may be experiencing a mental illness, and it's not as far-fetched as it seems. So with that, let's have a look at depression. When we're talking about depression, we are talking about a mental illness or a mental disorder, which has an overpowering effect on many parts of a person's life. And this, again, like I said, doesn't discriminate. And when I say it doesn't discriminate, there are not any specific gender, ages, that would be affected. It is open to everybody. And a lot of times I hear people say a child can't be depressed. That's absolutely not true. I hear people say men don't get depressed because we are strong. That's absolutely not true either. And what we have to acknowledge is that there is going to be a alteration in behavior and attitude when somebody is experiencing depression. Now, before we go into the detail of depression, I want to just make this very simple. I like taking complex things and making them very simple and easy to understand. In my brain, the easiest way to make sense of this when we're talking about depression and anxiety is acknowledging the past and the future. What this means is that when we're talking about depression, we're talking about things that have happened already that are impacting us, which is causing us to go into a state of depression. Now, I'll expand on that a little bit more. So let's say, for example, you've gone through a major life event which has changed your outlook on the world. It's altered your behavior, it's altered your attitude. You've now developed a sense of sadness, which is progressing into a feeling of hopelessness. You're starting to lack motivation. You're feeling discouraged. You can't remember what it's like to feel happy. It's rooted in the past. Okay. And this is where the hallmark of depression. It's things that have happened already. There are outliers. So we'll go into the detail of that, like genetics, certain medications that cause depression as well. Quite simply, it's already happened. The genetics have already been passed down. It's already in the past. Medication that you've taken, it's already in the past. Poor diet, it's already in the past. Can we move forward? Yes, absolutely. So when we're talking about depression, it's very much rooted in the past, being stuck in the past, not being able to move forward from there, largely because of a lack of tools, a lack of treatment options or access to therapy. And this is going to cause you to experience depression. When we talk about anxiety, on the other hand, it's very much living in the future. We all know what it's like to overthink things, okay? And we play out different scenarios about what's going to happen. The difference between this normal worry and anxiety is that normal worry isn't crippling. So when we are experiencing an anxiety disorder, we are living so far in the future, catastrophizing, playing out scenarios that haven't taken place as yet, and this is now starting to have a debilitating effect on our life. So when we look at depression and anxiety, it's in the past and the future, and we have to also acknowledge that depression and anxiety coexist in most cases as well. So most people who have been diagnosed with depression are so afraid of everything that's happened before that they already start preempting what's going to happen in the future, and this causes them to develop anxiety, and this is why it coincides. And vice versa, people who are so obsessed about the future are often referencing things that have happened in the past, which keeps them in that fear state, which is why they would experience anxiety and depression as well at the same time. Now, when we talk about depression, we are referring to these feelings of discouragement, sadness, hopelessness. And in severe cases, we acknowledge that people may attempt or think about suicide as well. We look at people not wanting to spend time with their family members, with friends, not doing things that used to bring them joy before as well. They may not find the motivation or the need to attend work. For students not wanting to go to school either as well. These are the hallmarks of depression, or in a nutshell, what depression is. Now, I mentioned there's a multitude of causes of depression. One of these is genetics, and the other thing attached to or rooted in stigma is that depression didn't exist maybe 20 years ago, or so people say. And this is absolutely not true. For any Shakespeare fans out there, like myself, you'll remember that Shakespeare described a lot of these characters as being melancholic. Okay, melancholy was the old word for depression. Over a period of time, those words changed. Then became hysteria in the 1940s, 1950s, and then it eventually evolved and turned into depression. So genetically, this mental illness has been carried down from generation to generation. In a South African perspective, we have to acknowledge that mental health still isn't accessible in many areas in 2025, and it was less available in the 80s, the 90s. And so a lot of our parents, grandparents didn't actually go and get diagnosed. So they just humped along with these symptoms of depression, and we never knew about it. And now I find that a lot of patients will say to me, I've been diagnosed with depression, and apparently it's genetic, but nobody in my family has depression. And then I start questioning, well, let's look at some of the behaviors that your parents or your grandparents exhibited, and now we can start to see the correlation. But just the absence of a diagnosis doesn't mean that it didn't exist in the genetics. Okay, so we have to be aware of that. I know it's very contentious to say, but I always say to people, did you have an angry mother? Was your mother always on edge? Was she sad? Did she hibernate away from everybody? She felt frustrated. She lashed out at people. Chances are she was going through depression. It's not an absolute. I know that, but those are early signs that we would look out for. The other thing that we would look at from a cause of depression would be brain chemistry imbalance. Again, rooted in the past, this is not something you have control over. Brains are different. We all have very unique brains. And sometimes there's an imbalance in terms of how the chemicals are produced in our body, which doesn't allow for the reuptake of serotonin, which is the hallmark of depression. Lack of serotonin uptake in the bloodstream, in the brain, and this would cause depression as well. Serotonin is your feel-good hormone, the one that makes you be able to experience feelings of joy and excitement and happiness. Now, when we talk about depression, there's the absence of those feelings. So it could be a brain chemistry imbalance that's causing the depression as well. Interesting to note, poor nutrition would ultimately affect brain chemistry. So if you're not eating the right amount of vegetables or nutrients, getting the right nutrients into your system, this is going to cause an imbalance from a chemical perspective in the body, and this could ultimately cause depression as well. Again, it's I didn't eat proper food in the past, and this is why I'm experiencing the chemical imbalance now, which is why I may be experiencing depression. There's also the concept of physical health issues that may cause depression as well, and this is twofold. The reason why I'm saying it's twofold, certain conditions require you to be medicated. I have come across so many people in the last couple of years who have these chronic autoimmune conditions. It's become a lot more common these days. And the medications used to treat a lot of these autoimmune conditions come along with the side effect of an alteration of brain chemistry and therefore the side effect of depression as well, which means that your doctor will prescribe the medication to treat your autoimmune disease or whatever other disease you're experiencing from a physical health perspective, as well as antidepressants, just to make double sure that you don't exhibit a major depressive disorder. Okay. The other reason why depression could be caused by a physical health issue for people who are diagnosed with terminal illnesses or severe illnesses, dread disease, like cancer, um, uh, you know, chronic conditions like emphysema, all of these things that would cause an end of life as you know it, this could allow you to spiral into a state of depression as well. So physical health plays a role in that. And again, it's rooted in the past as well, right? It's already taken place, and this could ultimately cause depression. We've spoken about medication or drugs. And drugs, again, we use it loosely because we talk about drugs from a chemical substance perspective, which could also alter brain chemistry over a period of time, ultimately causing depression. And then for your pharmacological treatments for certain conditions, this may cause depression as well. And then prolonged periods of stress, finally, over a long period of time without any reprieve from stress, you are going to find yourself feeling a little bit more hopeless, demotivated, and this becomes a very slippery slope then into depression. Again, rooted in the past. I haven't taken a hold of my stress levels. I haven't done anything differently. And so now I have found myself in the situation where I can't experience joy anymore. Now, what I often get asked is, what's the difference between sadness and depression? The difference is we all know what it's like to be sad. It's a universal experience. We've all lost something at some point in our life, and this is going to cause us to feel sad. But this will come and go, right? So we feel sad for now, and then later on we start to feel happy again. We can also isolate the specific event or trigger that's caused that sadness. Okay. And it doesn't have a significant impact on how we continue with our daily life. Okay. So I may be sad, but I can still do the things that I need to do. I can get out of bed, I can brush my teeth, do the laundry, get up, go to work, all of those things. Depression, on the other hand, is not a universal experience, and clinical depression is a medical condition that involves persistent feelings of sadness combined with hopelessness that proceeds for more than 2 weeks. This is debatable. So 2 weeks is the initial window period that we look at. We generally look at it over a period of time because I'll talk about in a bit situational depression. So we need to categorize between a major depressive disorder and situational depression as well. Now, importantly here, when we talk about depression, we can't always link it to a specific trigger. Okay. So in some cases, it may be, I've lost a loved one and I've never really processed that. And now it's 3 years down the line and I haven't processed it and it's now having a debilitating effect on my life. That is an exception. I can identify the trigger. But in most cases, people who are experiencing depression or have been diagnosed with a depressive disorder can't link their feelings of hopelessness and sadness to a specific trigger. It's generally an accumulation of things that have happened over a period of time, or in the case of the brain chemistry imbalance or genetic mutations that have taken place, you can't actually identify what the specific cause is that's causing this interruption or impairment to daily functioning. Now, I mentioned that we've the term situational depression. And situational depression stems from this difficulty in coming to terms with dramatic life changes. So oftentimes I'll hear people, in passing say, oh, don't speak to Karen, she's depressed at the moment. And I'll say, why is Karen depressed? And they'll say, Karen, I'm just using you as an example, I'm not prophesizing here, but somebody would say, Karen's depressed because her dog passed away last week. Is Karen depressed or is Karen grieving? And we also have to understand that the grieving process takes 18 months. So we can't use the term depression interchangeably with grief. There is a difference. We can have situational depression where past the 18 months, maybe 18 to 24 months, the person may be experiencing situational depression. Again, here there are multiple things that we would test for, such as what's the reason for it? Can we pinpoint a specific trigger? Can we help the person incorporate new skills into their dailiness that will help them try to find some joy or be able to process their feelings and move forward from there? So when we look at treatment options for situational depression, specifically related to loss, we would recommend that people attend grief support groups, speaking with therapists, engaging in cognitive behavioral therapy as well, in order for them to find acceptance and move on from there. On the flip side of that, when we look at what is referred to as major depressive disorder, or commonly called clinical depression, this is a very chronic condition which is severe enough to interrupt daily functioning. So we would look at five symptoms that we look at here, and these would be things like when last did you feel any joy? Are you experiencing any hallucinations, digestive issues, pain, unexplainable pain, headaches, and have you tried any treatment and it's not improving as well? So there's multiple things that we need to go and look at here. What's important to note is, and I said this earlier, when we talk about a major depressive disorder, it is a mental health illness which needs to be diagnosed and coupled with treatment. Okay, what that means is when you go to see a psychologist or a psychiatrist, they would go through a depression rating scale and then assess whether you are depressed, whether you're experiencing major depressive disorder, situational depression, or whether you're just experiencing a period of sadness. So don't go and diagnose yourself with a major depressive disorder without having seen a professional who's able to give you a proper indication. I often get asked, who's at greater risk, men or women, at experiencing depression? Quite simply, both men and women are equally at risk. When I spoke about this earlier when we spoke about stigma. There's a lot of stigma that men don't experience depression. Chances are it's because they don't seek help. So they don't actually get diagnosed with it. And that's why we assume that men don't experience depression, but it doesn't mean that they're exempt from being diagnosed with depression either. Now, when we look at the men in particular, there's generally a lack of emotional awareness. They aren't used to showing emotion in many cases. And also, this is very dependent. I'm talking very generally, it's not applicable to all men. And they typically don't feel comfortable speaking about their feelings. Females, on the other hand, may have a lot different life circumstances. Culture is a little bit different. They're allowed to speak about their feelings, but they're also struggling with multiple things like unequal power, status, work overload. Women are also predisposed to being sexually or physically abused, especially in South Africa. And these would basically increase their risk of experiencing depression as well. But it doesn't mean that they are at a higher or greater risk than men are. So we need to just dispel that notion. Now, when we look at the physical symptoms of depression, because believe it or not, there are physical symptoms of depression, there may be chronic headaches, dizziness, lightheadedness, decreased vision or developing eye problems, back pain, chest pain, constant aching in the muscles. We would acknowledge that there's stomach pain, uneasiness in the abdomen, digestive problems, fatigue, low energy, decreased pain tolerance. And this is going to be interesting when we look at the overlooked symptoms of depression in men as well. And I'll talk to you about that in a second. So when we look at commonly overlooked symptoms of depression in men, we see that physical pain, right? They would typically have backache, frequent headaches, sleep problems, sexual dysfunction, digestive disorders. These are overlooked symptoms of depression in men. Unprovoked anger, hypersensitivity to criticism, the road rage, abusive behavior. This is generally categorized as anger, and this is also an overlooked sign of depression in men. And then remember, I said to you that this decreased pain tolerance is generally associated or an overlooked symptom of depression in men as well, where they engage in reckless behavior. So all of a sudden, people are wanting to engage in extreme sports. They're trying substances because they've got this decreased pain tolerance, but also they're trying to substitute it with a feeling, some type of feeling. In most cases, people with depression or major depressive disorder would classify that they just don't feel anything. So they engage in these reckless behaviors because trying to feel something rather than nothing is better. And so this is where we have this reckless behavior. Now, really interestingly, if we look at these commonly overlooked signs of depression in men, we start to see that this is directly related with what used to be referred to as the midlife crisis. Okay, so in the midlife crisis, men would typically have sexual dysfunction. They were not satisfied in their relationships anymore. They were having difficulty in the bedroom, so they went and sought younger females in most cases, not mutually exclusive, but the typical characteristics of this. They sought younger females, thinking that would solve the problem. They became a lot more violent. They wanted the faster cars, extreme sports. They were doing reckless things that they didn't ordinarily do in the earlier years of their life. And they were probably more likely to engage in unsafe or sanitary sexual behaviors as well. In the past, we called this midlife crises. Nowadays, we know better and we recognize that actually these are signs of depression in men. Remember, we said men don't really speak about their emotions. They don't know how to access their emotions. And in many cases, these behaviors are actually an indication that the person is looking for validation, trying to find joy, which are all the hallmarks of a major depressive disorder as well. So for the men on the session, I hope that you start recognizing these things and start reaching out for help as well. Now, very importantly, when we're talking about depression as well, we need to explore what treatments are available. So many people talk about lithium, we talk about Prozac, Zoloft is also very common, Luvox, and there are also a lot of new treatments. So when we talk about new treatments, there's advanced treatments like transcranial magnetic stimulation or TMS, where there are, uh, uh, you know, rods and things inserted into the brain, not very different to the old ways of doing the shock therapy. We also have electroconvulsive therapy. Then we have the pharmacological treatments as well. So pharmacological treatments, this is medication that's available. So remember I said to you, serotonin is the one that is not being absorbed into the bloodstream when people are experiencing a major depressive disorder or being diagnosed with depression. So we use selective serotonin reuptake inhibitors, SSRIs, to treat this type of depression. These would be your Prozac, Zoloft, Cipramol, Lexapro, Serozat as well. I know this is a little bit outside of my scope, but I think it's important. I'm not going to give you the full details of all of these medications because that's not my area of expertise, but I want you to be aware of the common side effects, the considerations for both men and women taking these medications, and what you should be discussing with your healthcare provider if you are being prescribed these medications as well. So with the SSRIs, the common side effects would be nausea, diarrhea, insomnia, sexual dysfunction, and there would be mild fluctuation of weight as well. For specifically for men, you may experience erectile dysfunction, reduced libido, and delayed ejaculation as well. For women, we might notice libido changes as well, vaginal dryness, and possible menstrual irregularities here too. When you're speaking to your healthcare provider, you need to discuss any sexual health concerns. And the reason why I'm saying this is because we often will talk about the other health conditions or health concerns that we have with our doctor, but sexual health is also shrouded in this shame and stigma. So we don't discuss it, and yet we get put onto these medications, and then we have a bigger concern and an unspoken aspect of our life as well. So speak about this as well. For those of you that are on anticoagulants, you need to speak about the interactions with your doctor as well, about this as well. And then we have the tricyclic antidepressants like nortriptyline, sertraline and ibuprofen. And the common side effects here that we would look at is sedation, dry mouth, constipation, retention of urine, and then cardiac arrhythmias as well. So again, a lot of sexual dysfunction that could be caused here for both men and women. Worsening PMS symptoms for women that are on these tricyclic antidepressants as well. And it's important that you discuss with your healthcare provider your cardiac history here as well. There's also atypical or adjunctive antidepressants here. And this is where we're looking at Wellbutrin, Valdoxan, and here we're looking at gastrointestinal upset, liver monitoring that we need to be looking at as well. So really what's very important here is talking about liver functionality. Discuss this with your healthcare provider because there may be drug interactions with some of the other medication that you're taking as well. And then also sedation that we need to be looking at. So yes, there are treatments available in South Africa, but we need to be aware of what the impact of that is. Now, if we look at specifically the SSRIs, they typically take 4 to 6 weeks of being in the system for there to be full effect. And you may notice that you experience a little bit more anxiety with these as well. So always discuss with your healthcare provider what the side effects may be. Are there any other considerations that need to be taken into to effect before you start any type of treatment? What's critically important here is that once you get put onto any type of pharmacological treatment for depression, that you don't just abruptly stop the medication without the consent or direction by your healthcare provider as well. I also have concerns about people who are just put onto these antidepressants without being aware of it. So always Google the medication that your doctors place you on. I'll give you an example. I had a couple of years ago, I went to my GP, or no longer my GP, where I was experiencing flu-like symptoms, and the medication that he put me onto, he just naturally assumed, oh, let me put the person on antidepressants as well. Luckily, I recognized the name on the script, and I said to him, why are you putting me on antidepressants? And he was in shock, and he's like, how do you know that? And I said, well, you haven't even asked me. You aren't even able to just give me a script for antidepressants without doing a proper analysis. So educate yourself, be aware of what medication you're taking, do your research, understand whether there's anything that may be impacting you so that you are at the forefront of your own health as well. Okay, so that's depression in a high level overview. I know that we are not lecturing you on this to write an exam, so we're going to keep it quite high level as well. So with that, let's look then at anxiety. Now, when we're talking about anxiety, we have to understand that it's this very normal human emotion that we will experience at some point or the other. So if you've got a big problem at work, there's maybe some changes happening in your department or in the organization, you may have a little bit of anxiety. It's a normal experience. Anxiety disorders, however, are very different in that they cause so much distress that it affects the person's ability to lead a normal life. Now, I know the term normal is very debatable as well. What is normal? But when we talk about normal functioning in the context of mental illnesses, it's can the person function in terms of doing the basic things that they need to do. So getting up in the morning, seeing to themselves, taking care of themselves, personal hygiene, ensuring that you're eating, ensuring that you're carrying out the duties and functions that you need to do, like going to work, actually doing your job. Okay, those are things that we would consider normal life. Okay, can you maintain social relationships? Can you build relationships? All of those things would be things that we refer to as normal life. Now, for people with anxiety disorders, they don't just worry about things, they are constantly overwhelmed with worry and thoughts about things that haven't taken place. Remember, I spoke about anxiety is very much living in the future, and this starts to have a crippling effect on their day-to-day life. Now, when we look at the symptoms of anxiety, there's a multitude of symptoms that you may be experiencing with anxiety, and you could have one or more of these symptoms at any given point in time. Now, I do just want to touch on the difference between a panic attack and an anxiety attack. When we talk about panic attacks, we can isolate what is the reason for that panic. So we can take it down to one specific thing. When we're talking about anxiety, it's generally linked to multiple ideas or thoughts that the person has been ruminating, which is causing them to experience these symptoms. So yes, the symptoms for a panic attack and anxiety attack are very similar. The difference is, can I understand why I'm experiencing this, or can I not pinpoint the specific reason? Panic versus anxiety. For anybody who's had an anxiety attack before, you know that these symptoms may come all at once, or they may start a couple of minutes early, generally with the shortness of breath, and then it progresses from there as well. Now, when we look at the symptoms of anxiety or an anxiety attack, they can vary from person to person and on the type of anxiety disorder that a person may be experiencing. So when we're talking about specific anxiety disorders, because it's not just a blanket anxiety disorder, we would have agoraphobia, for example, which is an anxiety disorder where people are afraid of certain places or situations, which cause them to panic, feel trapped, helpless, and that would cause this anxiety attack, so to say. Okay. We also have anxiety attacks that are induced by a medical condition. Okay. So maybe I have a physical health problem, and because of that physical health, I'm constantly worried about how people are going to perceive me, or how I'm going to be able to carry out things that I need to carry out. And because I'm overplaying all of these things, what am I going to do? How am I going to have a normal functioning life? This is going to cause me to experience anxiety or an anxiety disorder as well. And then we have generalized anxiety disorder, which includes this very persistent and excessive anxiety about just about anything. So all activities, all events are just going to cause me to feel anxious. Normal routines are going to cause me to be anxious. And this worry is generally out of proportion to the actual circumstance. So somebody with an extreme major anxiety disorder may find that they wake up in the morning and the sun isn't shining and they start hyperventilating about how am I going to be able to do the things that I needed to do today? I wanted to do washing, and now the clouds are out and the washing is not going to dry, and it just spirals and spirals and spirals about things that haven't even taken place as yet. So it's out of proportion of the actual circumstance that one is being experiencing. Okay. And then, like I mentioned, this is different to a panic disorder, which would be intense feelings of anxiety or fear or terror that peaks within minutes, whereas anxiety attacks last a lot longer. And it's generally linked to a specific isolated situation. Okay. And then we also have selective mutism, which is often common in children, where the anxiety would cause them to not be able to speak, okay, in certain situations. So this is selective mutism, which is also categorized as an anxiety disorder. And also prevalent in children is separation anxiety disorder, where the child fears being away from the parent and what they would be exposed to if the parent isn't around. And this is what we refer to as separation anxiety. There's also specific phobias which may induce anxiety as well. So phobias of being around specific objects or situations like clowns and balloons. These are very good examples of that as well. And then we also have substance abuse anxiety disorders as well, where misusing certain types of drugs or taking specific medications could cause anxiety disorders as well. So what's important here is that we need to identify where is the distress coming from. Can we separate whether this is a panic or anxiety attack? And how do we recognize and isolate that from there? If you are exhibiting any of these symptoms, or you are worried that you may be experiencing anxiety, you need to be reaching out to your healthcare professional. Start off with a counselor who will then identify whether it's just something that's behavioral or whether it needs to be referred for a diagnosis. They will then refer you to a psychologist or a psychiatrist. If you don't want to go that route, you can go to your GP, who will be able to refer you to a psychiatrist. It's generally a little bit of a lengthier process, also more expensive process, but you would be able to get that diagnosis and then explore treatment options as well. When we talk about treatment options for anxiety, and I'll look at pharmacological treatments that are available shortly, But it's really important that we focus on breathing. Now, the reason for this is I said to you, when we're experiencing anxiety or when somebody is experiencing high levels of anxiety, they are obsessing about things that haven't taken place as yet. So they are living in the future. What they need to do is come back into the present moment. And focusing on the breath is a really useful way of doing this. So I like the triangle method where you trace your finger in the shape of a triangle. You're breathing in for the count of three. You hold that breath for the count of three, exhale for the count of three. And you can repeat that. You can use it on your cell phone as well. So breathe in, hold, breathe out, hold. For people with anxiety in traffic, people who have unprovoked anger, especially when you're driving, you can also use these breathing techniques. Trace your finger along the aircon vents, breathe in, hold, breathe out, hold. It just allows you to come back into the present moment. You're not stressing out about what's going to happen next or connecting things that have happened in the past, which may be causing that anger or frustration. So you're just bringing yourself back into the present moment. Other tools and techniques that you can use here, especially when it comes to anxiety, is using your five senses and following the rule of the ABC. So you take the letter A, what can I see around me? What can I touch? What can I taste? What can I hear? What can I smell? And then you just bring yourself back into your current situation and you are taking your mind away from these things that haven't taken place as yet. So when we look at these differences then between depression and anxiety disorders, we see that there are some similarities, but there's also stark contrasts as well. So depression, you may have a loss of interest in things, whereas in an anxiety disorder, you may be fearing things. With depression, you may have guilt or worthlessness, whereas with anxiety, you may have jumpiness or being tense all of the time. And these are important to note as well. What's really important to note here is that you can have anxiety, but you can still be confident. You can have depression, but you can still smile and make jokes. You can feel suicidal, but you can still show up every day and appear to be fine. There's no way to know unless you go and recognize the signs and symptoms and get help that's available, because there is help that's available. And it's important to note that help comes to those who seek it. Sessions like this are really good for recognizing the symptoms, but it's then dependent on you as an individual going and getting the help that's available to you. It's not just going to miraculously appear on your doorstep. When we're talking about treatment options that are available for anxiety, counseling, cognitive behavioral therapy, which focuses on identifying what's these thought patterns and trying to replace them with healthier ways of thinking, are really useful. It does take a little bit longer in that it requires consistent effort, and the progress is a little bit slow, but it's definitely an available option for you. You could also explore interpersonal therapy, which is focused on relationships or social roles, and this can help you communicate better, address grief and loss in the situations of bereavement, and it's generally more suitable for chronic or complex trauma-induced anxiety without any need for additional therapy as well. There are also mindfulness-based therapies that you could consider, especially for anxiety as well. So mindfulness-based stress reduction, or MBSR, or mindfulness-based cognitive therapy, MBCT. These would require also lots of practice where you're engaging in mindfulness activities, and these would be facilitated or guided meditations, guided workshops. These are all available as well. Excuse me. So when we talk about pharmacological treatments that are available for anxiety in South Africa, you see that there's also SSRIs that we would look at here. Fluoxetine is very common in South Africa. Again, these are generally accompanied by common side effects of nausea, headaches, insomnia, fluctuations in weight. And you'll see here as well that there's also a lot of sexual dysfunction with a lot of these treatments as well. So always discuss these with your healthcare provider before you start treatment. Another common one that people use in South Africa is the beta blockers. So these would lower your heart rate, which is directly treating a symptom of the anxiety that you're experiencing. This may reduce exercise tolerance, sexual performance, fatigue, and dizziness in women as well. And it's generally just used for situational anxiety, so predominantly social anxiety. And you also need to be cognizant of any heart conditions that may be prevalent because this would be affected. The pregabalins or adjunct treatments here, which are also common, especially for people with uh, 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 autoimmune diseases, Lyrica, um, these Lyrica generally comes with common side effect of drowsiness, dizziness, weight gain, and edema as well. And then you need to monitor for sedation. It may affect kidney function as well. So always be aware and do your research again as well, because as much as these treatments are available, you need to educate yourself and know exactly what you are getting yourself into. Okay, so always be mindful of this. Yes, it seems great to start these treatments, and I encourage you to have treatments, but be aware of the other considerations that come with those different treatments as well. Now, focusing on how do we move forward from here? What can we do? For both depression that's caused by stress and for anxiety, we need to focus on recharging ourselves. And often when we talk about recharging ourselves, people think that we just need to sleep. And this is not necessarily the case. When we're talking about rest that we need as individuals, physical rest is just one component. We also need creative rest, being able to do things that stimulate us creatively. Think about if you were in a state of depression, whether it be situational depression or you're experiencing a major depressive disorder, trying to find creative outlets for yourself to create a feeling of joy for yourself is going to have very positive impact for you. When we talk about people with anxiety disorders as well, using creative rest as a means to minimize the anxiety is really useful. We would look at coloring here, adult coloring books, really good for just focusing, bringing you back into the present moment, and doing something that stimulates a different part of your brain to make you minimize the feelings of anxiety as well. Mental rest is also very important. Sitting down with yourself and understanding what are these things that are clouding my judgment? What are the things that are playing or weighing heavily on my mind? And how can I separate them, unpack them, and process what needs to be processed and leave aside the things that I don't need anymore? From there, we can also experience emotional rest or prioritize emotional rest. Emotional rest is where you are sitting with yourself and you are understanding what are these things that are affecting me from an emotional perspective. Um, can I write them down? Can I come up with a plan of action? Can I choose to do something different and take control of the situation so that it's not clouding my judgment all of the time? And this in itself is a type of rest. We then need sensory rest. For people who are experiencing both depression and anxiety, switching off from your devices is really important. Why is it important? Because people who are experiencing depression, they could be triggered by multiple things. So they could be pushed further into a spiral of depression or a feeling of hopelessness or sadness by specific triggers that they may not even choose to be wanting to expose themselves to on their devices. For somebody with anxiety, especially people with social anxiety or fears around specific items, your phone is constantly bombarding you with information. You don't know what you're taking in and how this may be affecting your overall anxious state. Okay, so switch off from your devices as well. This is a type of rest. You also need social rest where you're allowing yourself to reconnect with people or else just switch off from people and recharge as well. So focus on social rest. Decide whether you need to socialize more or socialize less, And if you're socializing less, prioritize these other 6 types of rest that you need. And finally, you need spiritual rest as well. Now, spiritual rest is not just doing yoga and meditation, but it's also focusing on where do I exist in time and space. So you could go to a place of worship and connect that way spiritually. Or if you're not a religious person, you could connect with nature, and this would allow you to just acknowledge that things exist around you without your intervention. And this in itself will help minimize anxiety, helps you reconnect, bring yourself back into center, and also has been proven to minimize some symptoms of depression as well. Okay, so always prioritize this rest and understand that not all rest requires sleep. Now, when we talk about anxiety disorders specifically, setting boundaries is a really useful tool here to minimize your anxiety. So perhaps you have difficulty communicating what it is that you need to say, or you have difficulty with people just telling you things all of the time because you don't know whether it's going to be a trigger for your anxiety. So you may have a verbal boundary here or an emotional boundary that needs to be put in place. So I know that when I worked in corporate, I used to have a manager who used to send me calendar invites and say, can we have a meeting at this time? But there would be no agenda, no meeting points. There's no consideration about what else I'm working on. And this would cause me to experience anxiety at some level. Okay. So the way that you would overcome this is putting a boundary in place. So in this case, it would be an emotional boundary. How am I protecting my thoughts and feelings? How am I minimizing my anxiety? So I'm going to follow this very simple 4-step approach, which can be used for any of the 8 categories of boundaries. The first thing you need to do is identify what is the boundary that needs to be put in place, or what category of the boundary are we referring to. In this case, I'm trying to manage my emotion or the feeling that I'm having, the feeling of anxiety. So I understand it's an emotional boundary. Now I need to decide what's clear and enforceable. So I decide that going forward, I'm not accepting any type of invitations for meetings unless there's a clear agenda so that I can prepare myself and take away any obsessive detail around what's going to happen in that meeting, which is going to cause me to experience anxiety. And now that's clear and enforceable. So most people do steps 1 and 2 really well. Challenge comes in when you are doing step 3, which is where you are communicating this boundary to the people that are going to be affected by it. So if I don't tell my manager that going forward, I would appreciate if you included an agenda in any of the meeting requests that you send me, my manager is not going to know. I'm not going to be able to enforce the boundary. I can't push back on my manager and say, I'm not accepting this until you give me a clear outline of what we're going to be discussing, because right now I'm just becoming very anxious because I don't know what to expect. And this is how you would enforce that boundary. So if you follow this 4-step approach, you're going to be able to set these really healthy boundaries for yourself, bring yourself back into the present moment. You're not allowing yourself to be carried away by things that are outside of your control. So with that being said, let's look at the key takeaways that we need to be looking at. So the 3 key takeaways that we're looking at is that awareness is firstly the first step. Once you start recognizing the signs of depression and anxiety, you start acknowledging whether there's any changes in your mood, your energy, your sleep, your appetite, allows you to get some action going. Okay, so you can already start seeking help. You can start getting treatment. The second takeaway that we're getting from the session is that treatment works, whether it's lifestyle changes or medication or a combination of both. Seeking help is actually a sign of strength and not a sign of weakness. And finally, support is essential. You don't have to face all of this alone. There are trusted healthcare professionals that are available to you, counselors that are available to you, or even just your family, colleagues, or friends. Taking this first step of opening up, acknowledging what coping strategies exist, and starting to incorporate them into your daily life can make a huge difference. I want to leave you with this thought that mental health is not just an individual responsibility, it's a community and workplace responsibility. And by understanding, normalizing, and supporting mental well-being, we start to create environments where people can thrive and not just survive. So I encourage each of you to take what you've learned today and reflect on your own well-being and the well-being of the people around you. Remember, asking for help is a sign of strength and not weakness, and awareness is the first step. Action is the next. And with the right support, recovery, and resilience, progress is absolutely possible. With that, are there any questions? Karen?
Hi, Vishen. There were a couple of questions. I'm not sure if you have access to the Q&A.
Yes, let me open up that. Okay, so so I see the first question from the anonymous attendee. My daughter bites her school pencils and nails, but I gave her a teddy bear to stop biting her nails and it works. How do I help her to stop biting her school pencils? She's only 6 years old. Nice question. What I would suggest that you do here is reach out to somebody who your daughter can speak to. If she's not opening up to you about what's causing her the anxiety, because this is definitely situational anxiety. In most cases like this, there's something happening at school, possibly bullying behavior. Remember, this is all just ideas. We need to do a deep dive to get the exact reasons for it. So understand there may be bullying that's taking place. She may be afraid of her teacher. She may be afraid of the environment. She may be uncomfortable in the environment that she's in, which is causing her to bite on her school pencils. The teddy bear is a substitution for this. Now, there's a lot of different schools of thoughts around these emotional support treatments, using animals or teddy bears as a substitute for creating comfort. While it works, we also need to be mindful of the fact that there's going to be a long-term dependency that's created. So be cognizant of this, try and find a way that's going to address the actual problem rather than just put a band-aid over what your daughter is experiencing. Okay. The second question that I'm seeing here is how do you go about getting treatment? Really nice question. First thing you want to do is you want to reach out to a counselor or a psychologist. You can either book this. Most companies have an EAP program. You can either go through your EAP program. They'll be able to signpost you. So they'll do a full analysis, interpretation, and then guide you in terms of how you go forward from there. Treatment is unique to individuals. So there's no one size fits all for treatment. So don't get caught in the trap of what my colleague who's got anxiety is experiencing and what the treatment options that he or she is going through is going to necessarily work for me. You need to focus on what is specific to you, and that requires you to see a professional who's able to discuss treatment options with you. I see there's another question here around, do you have any professionals that we can contact for therapy? This is a very nice question. I could give you a whole host. You can Google therapists in your area. What's really important to notice here is that it's not just about accessibility, right? There's multiple other things that we need to take into consideration. What I mean by this is that for somebody who's experiencing depression, for example, or somebody who's experiencing anxiety disorders, you need to speak to somebody that you can relate to. So we often don't take this into account, but the gender of the person that you're going to for therapy is really important. Who do you feel most comfortable with? Is the person of the same background as you? If your depression or your anxiety stems from cultural conditioning, then speaking to a therapist who shares similar values or has exposure to your culture is going to be really useful. So, yes, therapists are all trained in the same way, but they are all unique in terms of what they offer. So, do your research, ask for recommendations from your GP or your EAP professionals who are going to be able to signpost you, but there are therapy professionals out there who's going to be able to assist you. So I know it's not the exact answer you're looking for, but there is treatment available for you. I see there's another question of what would be the best advice you'd give to somebody struggling with drug and porn addiction? And could it be a symptom of depression? Yes, it could absolutely be a symptom of depression. Remember, we spoke about one of the symptoms of depression is trying to engage in other type of behaviors that will make you feel something. And this is where the drug addiction or porn addiction comes into play as well, because I'm trying to find an escape to make me feel something other than nothing, because that's what people with depression generally describe their feelings as. I just feel nothing. I feel numb. So yes, they can definitely be intertwined. For somebody who's experiencing drug addiction and porn addiction, reach out to the closest available rehab centers that are available to you. One of the most underrated treatment centers that most people in South Africa don't access is Akiso. Most medical aids cover this. You don't need a referral letter to go to Akiso. Check in at Akiso. You can do an inpatient or an outpatient program, and they'll be able to equip you with the tools. You can also speak to any therapist that is in your area who specializes in this. If you go onto the Psychological Society for South Africa, onto their website, you'll be able to do a search of therapists that are closest to you and their areas of specialization. And this is where you are going to find the people who would be able to assist you with that. Okay, so I hope that answers your question there. Patrick, I do see your question around which autoimmune medications are implicated here. I'm going to not give an answer because, like I said, when we spoke about pharmacologicals, that is not my area of expertise to know the implications from a how do they work in conjunction with each other. I'd suggest that you speak with your medical doctor here. I'm just giving you the information around the treatments for anxiety and depression, what's available to you. So I'm sorry, I can't give you a full detailed answer there, but your medical practitioner would be able to assist with that. Karen, do we have time for one or two more questions?
I think let's just take two more, if you don't mind. And then for those that we don't answer, we'll share that feedback in the communication back to all the attendees.
Perfect. I'm happy with that. So really see a really nice question here from an anonymous attendee. How do you advise stopping the biting of the inside of your mouth and lips? This is actually one of the symptoms of anxiety. So that constant biting, fidgeting. So you need to be working with a cognitive behavioral therapist who will explore what is the reason for you doing that. And then how are you going to overcome it? So there's multiple things that you can do. Some people use the rubber band. So you put a rubber band over your hand and you're basically reconditioning yourself. So every time you acknowledge that you are biting the inside of your mouth and lips, you pull the rubber band, and that's going to recondition you like Pavlov's dog, for those of you who are familiar. And then you start pulling yourself out of that habit of biting the inside of your mouth and lips. So cognitive behavioral therapy is going to be the best possible treatment there. You could try and take medications, not really going to be as effective as going through the therapy route there. Okay, and then one more. What causes the lack of trust to people and also being on edge, like being jumpy when a sudden sound hit? How can this be overcome? Okay, really interesting question. This could be one of two things. So it could be related to anxiety. So, I'm overthinking a lot of the time about what's going to happen next. And so the slightest movements could cause me to have heightened anxiety, but it could also be a symptom of post-traumatic stress disorder. So I've been through a situation before and my mind hasn't processed all of those events. We also live in South Africa, so crime is prevalent a lot. So maybe you were a victim of crime before, you've been in a hijacking, a home robbery, those sudden noises are triggering you, and this could cause you to develop a lack of trust in people and also cause you to be on edge when you hear certain sounds. So how do you overcome this? Speak to your therapist, speak to a counselor, speak to a psychologist, unpack the details of it. They will do a deep dive with you to understand what the root of it could be and then start working from it there. So it's not a quick fix. You've got to go deep dive. You can do it on your own, deep dive into why is the sound bothering me? Is it a specific sound or is it just loud sounds in general? And then try and find any links to that and then work down and understand, okay, so now I've gotten to the root of it. How do I start now putting different strategies in place so that I can overcome this? And that's how you're going to be able to overcome that. So yeah, we'll stop there, Corinne. Thank you very much to everybody on the session. Thank you for joining. I hope you found it extremely useful, and I hope that you walk away with at least one, if not at least 10 new things that you've learned about anxiety and depression.
Thank you. Thank you, Vishen. That was extremely informative. And thank you to everybody that attended today. On behalf of NMG, we really value your participation. I think mental wellness is an essential part of overall health. So we hope that we've been able to equip you with some of the tools, insights, and resources that will help you lead a more balanced lifestyle, of course, and a healthier one. Certainly, we'd like to continue these informative sessions. If you do have any topics that you'd like us to include going forward, please reach out to us. We really do value the information that you give to us. But of course, to everyone here online, we hope that you have a wonderful afternoon further, and we look forward to connecting with you again. So thank you. And of course, last but not least, we will be sharing the recording with you, and of course, answering some of the questions that we weren't able to get to. So have a wonderful day, everyone. Keep well. Bye-bye.
Bye-bye.